Our patient is a 73-year-old female who dislocated her left shoulder during a recent fall. She's been in therapy for 4 weeks, but she's continuing to complain of limited functional mobility due to weakness and pain. The patient reports increased pain at night and feeling of shoulder instability, and her goal is to return to recreational swimming. So at this point, because she's been in therapy for 4 weeks, we might be asking her if she's been doing her home exercises that she's been given. Maybe we need to, talk to the doctor again, see if she needs further testing. But our goals for the therapy session are strengthening because she has that weakness and then trying to subside the pain. We might be asking her about positioning the arm at night to see if that helps with the pain and helps her with sleeping. Based on her history, she said that she didn't, she hasn't had a fall before. She just tripped over her dog and fell. So we're not too worried about her balance and stuff like that. And we don't have any real reason that we might have to check her vitals at this point.
Oh, okay. Hey, Bree.
Hi.
Hey, I'm John. I'm a student physical therapist here at Baker. Understood you had a fall a few weeks ago, and you're still having some pain in your left shoulder?
Yeah, my shoulder popped out.
Popped out?
Yep.
And they put it back?
Mm-hmm.
All right. Can you tell me where the pain's at right now?
It's just aching all over.
Everywhere.
Yeah, it just...
Could you point to it with one finger, or?
Right now it just hurts everywhere. I
Okay.
guess mostly in the front though.
Okay, so not too much in the back,
Yeah.
in the front. Okay. At rest right now, what would you say your pain's at from 0 to 10, 0 being no pain, 10 being the worst pain you've ever experienced?
Just sitting here, I'm at a 4.
At a 4? Okay. And does anything increase that pain?
Yeah, I'm moving my arm.
Moving it, how so? In front of you, to the side, behind you, reaching for stuff?
A lot mostly to the side is when I notice it.
Okay. All right, well, we're just going to go through some screens. Pretty simple. We'll use both arms to see. I want to see your right arm, which is not affected, and compared to the affected side. All right, so you'll stand. You can just put your thumbs like that. I'll have you stand up. All right. And so thumbs up. We're just going to raise hands overhead. How you doing with that?
A little bit of pain.
A little pain. All right. Try and keep your shoulders down. You're starting to get a little hiking like that. All right. I want to see to the side. We're just thumbs up, raising. All right. So how's that?
Very painful.
All right. I see. Not quite as high with that side.
I don't like trying that one.
Okay. How about could you stand to your side and go behind you?
Kind of painful in
Kinda
the front.
painful? Okay. Was any of those movements more painful than the others? Or?
This one.
That one hurt the most?
Mm-hmm.
Okay. Could you point out where that pain was when you were doing that movement?
No, just my whole shoulder hurt.
Okay. So Bree, I'm going to get some measurements and see just how far your range of motion is here. So I'll start, we'll have you laying down on your back on this mat here and get all the way up so your feet are supported. Okay. And actually I can have you scoot closer to the middle. That might make it more comfortable. So, all right, and I want you to do the movement and just bring your hand as far up as you can towards your head. Good? Okay, so I would say that's within functional limits. That's good. I want to see this other side. Yep, all right. I'll bring it back for me really quick. And I'm going to kind of stabilize the shoulder here because I don't want you using that. Bring it up. Is that about as far as you can go?
Mm-hmm.
And what's limiting you from going further?
Painful.
Okay. So let's go just below where it's painful. All right, I'm going to take a measurement. I get 52. All right. So below where we want it to be functional. All right. So have you come back here. And I just want you to relax, and then I'm going to move it and see how it compares to active. All right. You tell me when it gets to be too much.
It's okay.
Okay. All right. So I'd say passively, when I'm doing all the work, you're getting into functional limits that we want to see. So that's telling me that it might be more a muscular thing. So that when she's activating the muscle to abduct, that's when her pain is showing up. Now I want to do some strength testing. So I'll have you sit at the edge of the bed, please. All right. We're going to start with, have you actually stand up, facing in. All right. I'm going to have you bring your arms 90 degrees up here. Don't let me push you down. Okay. This one seems a little weaker. All right. Is that due to
A little bit of pain, just with any motion. I feel pain in the shoulder.
anything we do, you're getting a little bit of pain?
Yep.
Okay. I want to try, bring your arms out with your thumbs up. It's hard, I don't want you to be in that painful range yet, so about right there. All right, don't let me push you down. All right, so pretty weak there. Now I want to check internal, external rotation. So we'll start with your right. All right, don't let me push you out. Good. Don't let me push you in. Good. And try this one. Don't let me push you out.
A little bit of pain.
Okay, don't let me push you in.
A little bit. Not too
Okay. Decent strength there. Special test to try and figure out what the actual problem is. We know that the shoulder isn't moving how we want it. There's pain with active range of motion. So we're going to try and see if we've got a tear, impingement, or whatnot. So the first test we're going to do is the apprehension test. Checks for anterior instability. Most shoulder dislocations are anterior, like 95% of them. So it's likely that we could see that. Wink, wink. So I'll passively, because Bree has pain bringing it out, but no pain passively, this should be okay as far as I get her into this position, 90 degrees abducted, and then I'm going to bring her into external rotation until I get pain, if there is any.
Feels like it's going to pop out.
Okay, so we're going to stop there, and we would say that is a positive sign for the apprehension test. Then I'll have Bree, if you can sit on the edge here. We're going to do the Hawkins-Kennedy test, which is testing for supraspinatus impingement, or it's, subacromial impingement. So for this, I'll have you flex your shoulder to 90. Or more, I'm passively putting her into this flex position. And then we're going to see how far I can bring her into internal rotation, if there's any pain.
Only a little.
No pain? Any more?
A little bit.
Okay. So that's pretty good. Little pain here. Could be some impingement. She's fine doing that. So now we'll move to checking the supraspinatus. We'll just drop arm, empty can, full can. We'll start with the full can, which have you bring your arm out in the scapular plane, thumb up, and then don't let me push you down.
Really painful.
Painful, okay. Empty can, same thing. Pointing the thumb down though, still resisting any pressing down.
Painful.
Painful. Okay, so that is a positive sign for both of those tests, indicating potential for a supraspinatus tear. Now we'll do the drop arm, where I'm passively bringing the arm into 90 degrees abduction, thumbs up. I'm going to ask Bree, I'm going to let go of your hand, hold it in that position against gravity, okay? Okay. How was that?
A little painful.
Okay. So she wasn't able to keep that arm up there. There was a drop, which was positive, and then there was pain even when she was able to keep it against gravity. So that would be another positive sign for the drop arm test, indicating supraspinatus tear potentially, or some involvement with that. Next test we'll do is to try and rule out any subscapularis involvement. So Bree, it's the lift-off test. You're going to put the back of your hand to the small of your back. All right? And then you're going to try and lift it off of your back as best as you can. Great. Any pain with that?
Very little.
All right. So not much pain. With all of these, I could ask, 0 to 10, what do you rate that pain? Is it just discomfort? Is it sharp pain? Getting all the qualities of pain there. But I would say that's a negative test. She was able to get a pretty good lift off with negligible pain. All right. So from our special test, the active and passive range of motions, comparing those, we think there is some involvement with the supraspinatus, likely a tear or some kind of other impingement, but because of the drop arm, we're thinking more tear. So that could be expected, especially since she's been in therapy for 4 weeks and still has this issue, and therapy alone isn't doing everything she needs it to do for her. So I'd probably recommend maybe contacting the physician if it doesn't get any better. But while we have her here, we can work on some things. We can work on strengthening specifically to try and help the instability. So first thing we would try and do is an active assisted range of motion exercise with Bree in a gravity eliminated position on a bed or something at home. You grab a racket, broomstick, dowel, any rigid stick that allows you to just rest your hand against it. You can grip a little bit with your left, and then you're going to lift as much as you can along that bed. And if you need to, you can push through with your right. All right. We want you going just below the point of pain, and then you can do back down. All right. So have you try that. Yep. And as much effort as you can coming from your left arm. Again, don't bring it into the range where you're getting pain. Once you're right below that, we don't want to make that problem any worse, create more inflammation. So at home, you can do this 3 times a day. It's easy if you try when you wake up, when you get home from work, before going to bed. Do 3 sets, 8 to 10 reps, 3 times a day. Next, we can do some exercises against gravity. So I have you sit up or standing, whatever is better for you. Again, we'll do these 3 times a day, the same with the other. So we can just do some shoulder flexion against gravity, as far as you can go. If you get in that pain, go right below where it's painful. You can do that 3 times, 3 sets of 8 to 10 reps. All right, we're working on the instability issue. Also, you can do the internal-external rotation. So we can progress to using a band. This will be a gravity-eliminated internal-external rotation. If that's too easy, you can lay on your side, which will be on your right side. And you can raise your hand up. There you go. That's external. Good. And then internal, just lay supine. And then bring it up. And again, we can add TheraBands as a progression to this. And that is our intervention.